Good afternoon. My name is Lisa Cordova, and this is my remote collaboration and evidence-based care presentation for Nursing Flex Plan 4030 Assessment 4.1. During the presentation, I'll present an evidence-based care plan that will improve the safety and outcome of the patient in Villa Health remote collaboration on evidence-based care media scenario. I'll describe which evidence-based practice model I used to develop the care plan, and I'll reflect on which evidence was the most relevant and useful when making decisions regarding the care plan. And finally, I will identify the benefits and strategies to mitigate the challenges of interdisciplinary collaboration and planned care within a remote team. Let me remind you of the patient. Her name is Caitlin, a 2-year-old who came into the ED last night. She was admitted for pneumonia and malnutrition, the second time in 6 months. A multidisciplinary workup diagnosed Caitlin with cystic fibrosis. The team members are now collaborating to come up with a care plan to assist with Caitlin's care. Dr. Copeland started Caitlin on IV antibiotics. Respiratory therapy is administering nebulizer treatments and chest physiotherapy. In addition, they are putting her on pancreas enzymes, a high-protein, high-calorie diet, and fat-soluble vitamins A, D, E, and K. Caitlin and her family live about an hour away in a rural area. Her parents are separated and both work full-time. The father just recently got back to work after an extended unemployment. They have excellent benefits but are still catching up financially. Caitlin has a pediatrician in her small town, Dr. Benjamin. The collaboration with the rural clinic will be important in continuing Caitlin's care and monitoring her condition, especially when there are exacerbations of the illness that require more aggressive treatment. In addition, the home situation, Caitlin's young age, and learning to cope with their child's chronic illness will bring challenges. The education and support for Caitlin and her family will be crucial. Telemedicine refers to the remote practice of medicine utilizing modern telecommunications, multimedia computer technology, electronic technology, and other technologies to remotely collect, transmit, process, store, and inquire medical information to perform a medical examination, to diagnose, educate, and manage information gathered. It is used to provide medical care in areas where medical care may be limited. Q, Ma, and Wang, 2020. Let me begin by making a care plan for Caitlin. I'll be using the Johns Hopkins evidence-based plan model, practice model. The first step is practical question. Using a team approach, what is an evidence-based practice question that can be identified? The question chosen is how elaborate care is to be organized remotely to support the patient and her family. Second step, evidence. The care team searches, appraises, rates the strength of the evidence, rates the quality of evidence, and makes a practice recommendation based on the strength of the evidence. The team in this scenario is the Valley physician, Dr. Copeland, the Valley nurse, Virginia, Valley respiratory therapist, Rebecca, and the Valley social worker, Marta Simon. The rural team, Dr. Benjamin, the rural McHenry pediatrician, Madeline, the rural McHenry social worker, and lastly, Janice, Caitlin's mother. To research evidence-based practice databases used will be filtered by scholarly, peer-reviewed articles that were published in the last 5 years. To ensure both the credibility and validity of the information, searching 3 resources. To start, using different databases to search the 3 different sources of a plan of care for patients with cystic fibrosis, the filters of peer-reviewed journal article and last 5 years were applied. Source 1, Cystic Fibrosis, Elborn, 2016, had 4 basics plan of care. We will review these later when we put in our final findings. The source 2 was best practices in the treatment and management of cystic fibrosis, recent updates and advances in CFTR therapy, Patrick Flume, 2021. And then source 3, next generation sequencing for molecular diagnosis of cystic fibrosis in a Brazilian cohort by et al., 2021. Those have 5 categories of objectives of guidelines. After the team reviews all of the information, rating the strength of evidence, quality of the evidence, the practical recommendation developed and encompasses the evidence-based practices noted in all the resources. Translation: an action plan is created, change is implemented and evaluated as the management of Caitlin's care begins. First, it is apparent in all studies that there be a multidisciplinary team, both in the rural area where she lives and for more comprehensive higher level of care in the city. The team consisting of physicians, nurses, respiratory therapists, dietitians, social workers, psychologists, pharmacists, and other specialties that might be needed as the disease progresses. This team is not only there for the physical and health maintenance of Caitlin, but to support her and her family emotionally as they go through this process. This is the beginning of a relationship that will be fostered for years as Caitlin grows older. Augmenting airway clearance with medications that thin and break down mucus, bronchodilators, and CPT therapy. This would be taught to the parents by interdisciplinary team, in this case, the respiratory therapist. It would be very important to maintain and stay on top of Caitlin's airway clearance. Thick secretions can turn into mucus plugs that decrease oxygen and occlude the lungs. This appointment could be done by telemedical appointments set up between the caregiver and the respiratory therapist, being mindful that the parents may have difficulty being together. Keeping care focused on Caitlin and her well-being should help to keep them focused instead of tense toward one another. But if not, extra sessions may be needed to assure both parents get the training. Aggressive early treatments of infections with IV, oral, and inhaled antibiotics. This will help prevent Caitlin from getting sicker or having complications from illnesses. Dr. Copeland began treatment and had a meeting with Dr. Benjamin, the pediatrician in McHenry. It will be important to collaborate and monitor Caitlin carefully, and having a doctor close by to where she lives and her parents to monitor and get quick interventions as well as reassurance to parents when they need it. The two doctors can talk on the phone or via telemedicine with one or both parents and Caitlin if the need arises. CFTR target medications that work specifically on mutated cells or using gene therapies are also options that the parents can discuss with their physicians. The nurse can serve as a liaison between the doctor and parents or can be available to the parents for reinforcement of education. There's a lot of information coming with this complicated diagnosis, and every patient is different. Nutritional support with pancreas enzymes, additional high-calorie, high-protein diet, and A, D, E, and K vitamins, fat-soluble vitamins, is a good start to helping Caitlin get the nutrition her body needs. A dietitian will be helpful, especially as young children can be picky eaters, and having a professional to consult will be essential in keeping Caitlin healthy. As the disease process progresses, the dietitian may need to reevaluate Caitlin's dietary needs. The benefit to having remote collaboration is that Caitlin will have care close by if something comes up quick, or if the parents are not sure and just need to have her assessed. The two physicians or other providers can coordinate care that best suits Caitlin and her family's needs. Caitlin can still go to the larger hospital when more aggressive or higher level of care is needed. The doctors can communicate and quickly address complications as they arise and aggressively treat to prevent further escalations of the illness. The challenges of remote collaboration may be finding support for the family in such a small rural town. Their rural medical team support systems should be sensitive to all parties, and team members should support both parents in the care of Caitlin, whether it be together or apart. Being in a small town, the family may find support systems via online support groups, Skype, or Facebook. The social worker would be instrumental in helping them to find groups that can give them those resources to assist not only with their emotional needs, but the added financial costs that additional help may be needed to assist with Caitlin's care. In conclusion, remote collaboration can be very useful tools to issue with accessibility to prompt medical care. Using evidence-based practice models help to guide research to finding evidence-based practice solutions. Caitlin's family was able to gain access to a lot of information and resources that they may not have had access to had they not been set up with telemedicine. Improving access to medical professional is an excellent way to improve safety and patient outcomes. Thank you.